Assalamualaikum warahmatullahi wabarakatuh. Today we will talk about a forum about the health of the sustainable development goal, which is SDGs. So here I will introduce to you two of the panel. Me as a moderator, and for the first panel is Muhammad Naim Ramli as the vice president of the WHO, and for the second panel is Muhammad SHAHRIN bin Muhammad SHAMIZAM as the researcher of the WHO. So today we will talk about the health of the sustainable development goals. So the introduction. The era of the sustainable development goals has begun. Health is well placed in the SDGs. The health goal is brought for the purpose. The SDG declaration emphasizes that to achieve the overall health goal, we must achieve universal health coverage and access to quality healthcare. No one must be left behind. So, this place for the Sustainable Development Goals in health as at the center of the SDG. The health goal as a contributor to and beneficiary sustainable development with linkage of all the other SDG targets. So, my question I will ask to the Mr. Naim as the Vice President. What is your opinion about health in SDGs as you are the Vice President?
Okay, thank you to the moderator. I am Muhammad Ramli as Vice President of World Health Organization, and I will explain about the question. For ensuring healthy lives and promoting well-being at all ages is essential to sustainable development. Currently, the world is facing a global health crisis unlike any other. COVID-19 is spreading human suffering, destabilizing the global economy and upending the lives of billions of people around the globe. Before the pandemic, major progress was made in improving the health of millions of people. Significant strides were made in increasing life expectancy and reducing some of the common killers associated with child and maternal mortality. But more efforts are needed to fully eradicate a wide range of diseases and address many different persistent and emerging health issues. By focusing on providing more efficient funding of health systems, improve sanitation and hygiene, and increase access to physicians, significant progress can be made in helping to save the lives of millions. Health emergencies such as COVID-19 pose a global risk and have shown the critical need for preparedness. The United Nations Development Programme highlighted huge disparities in countries' abilities to cope and recover from the COVID-19 crisis. The pandemic provides a watershed moment for health emergency preparedness and for investment in critical 21st century public services. The World Health Organization, which is WHO, has been leading the global effort to tackle COVID-19. The Strategic Preparedness and Response Plan produced by World Health Organization or WHO and partners outlines and the public health measures that countries should take to prepare for and to respond to COVID-19. The strategy update of April 2020 provides further guidance for the public health response to COVID-19 at national and sub-national levels and highlights the coordinated support that is required from the international community to meet the challenge of COVID-19. People and organizations who want to help fight the pandemic and support WHO and partners can donate through the COVID-19 Solidarity Response Funds, which support WHO's work to track and understand the spread of the virus, to ensure patients get the care they need and frontline workers get essential supplies and information, and also to accelerate research and development of a vaccine and treatments for all who need them. WHO, together with partners, also provides guidance and advice for people to look after their mental health during the COVID-19 pandemic, especially health workers, managers of health facilities, people who are looking after children, older adults, people in isolation, and members of the public more generally. The pandemic is much more than a health crisis. It requires a whole of government and whole of society response, matching the resolve and sacrifice of frontline health workers. So, that's all from me for my part. I give back to the moderator.
Next, I will proceed to the Mr. Shahrin. Mr. Shahrin, you as a researcher in WHO, what is the fact and figure in overall health?
Okay, I'm Mr. Shahrin as a researcher of WHO. For the first, I will talk about child health. In 2018, an estimated 6.2 million children and adolescents under the age of 15 years died, mostly from the preventable causes. Of this death, 5.3 million occurred in the first 5 years, with almost half of this in the first month of life. Despite determined global progress, an increasing proportion of child deaths are in sub-Saharan Africa and Southern Asia. 4 out of every 5 deaths of children under age 5 occur in these regions. Children in sub-Saharan Africa are more than 15 times more likely to die before the age of 5 than children in high-income countries. Malnourished children, particularly those with severe acute malnutrition, have a higher risk of death from common childhood illness such as diarrhea, pneumonia, and malaria. Nutrition-related factors contribute to about 45% of death in children under 5 years of age. That's all for the child health. For the next point, I will talk about maternal health. Over 40% of all countries have fewer than 10 medical doctors per 10,000 people. Over 50% of countries have fewer than 40 nursing and midwifery personnel per 10,000 people. In Eastern Asia, Northern Africa, and Southern Asia, maternal mortality has declined by around 2/3. Every day in 2017, approximately 810 women died from preventable causes related to pregnancy and childbirth. 94% of maternal deaths occur in low and lower middle income countries. Young adolescents about age 10 until 14 face a higher risk of complications and death as a result of pregnancy than other women. But maternal mortality ratio, or we can talk about the proportion of mothers that do not survive childbirth compared to those who do, in developing regions is still 14 times higher than in the developed regions. Now, I will talk about HIV, AIDS, malaria, and other diseases. Okay. For your information, about 38 million people globally were living in HIV in 2019. 25.4 million people were accessing arterial therapy in 2019. 1.7 million people become newly infected with HIV in 2019. 690,000 people died from AIDS-related illness in 2019. 75.7 million people have become infected with HIV since the start of the epidemic. 32.7 million people have died from AIDS-related illness since the start of the epidemic. Tuberculosis remains the leading causes of death among people living with HIV, accounting for around 1 in 3 AIDS-related deaths. Globally, adolescent girls and young women face gender-based inequalities, exclusion, discrimination, and violence, which put them at increased risk of acquiring HIV. For your information, HIV is the leading cause of death for women of reproductive age worldwide. AIDS is now the leading cause of death among adolescents about age of 10 until 19 in Africa and the second most common cause of death among adolescents globally. Over 6.2 million malaria deaths have been averaged between 2000 and 2015, primarily of children under 5 years of age in sub-Saharan Africa. The global malaria incidence rate has fallen by an estimated 37% and the mortality rates by 58%. I think that's all. I will answer your question.
Okay, thank you for your information, and I think the information is too useful for us. And now I will proceed same panel, which is Mr. Shahrin. For the next question is, can you explain the progress of the health in SDGs, which is Sustainable Development Goals in health, since you already participate as representative for WHO in that SDGs? Mr. Shahrin?
Okay, thank you for the question. As a researcher, I will talk about the infectious disease. Major advances have been made in combating infectious disease. Globally, in 2015, there were 0.3 new HIV infection per 1,000 uninfected people. Among children under 15 years of age, there were 0.08 new HIV infection. That data represent a decline of 45% and 71% respectively since 2000. The incidence of HIV infection remained highest in sub-Saharan Africa with 1.5 new infection per 1,000 uninfected people in 2015. In 2015, 10.4 million new cases of tuberculosis were reported worldwide, which represent 142 new cases per 100,000 people, or a decline of 70% since 2000. The global malaria incidence rate in 2015 was 94 per 1,000 people at risk, 41% decrease since 2000. In 2015, 1.6 billion people required mass or individual treatment and care for neglected tropical disease, about a 21% decline from 2010. Around 1.34 million deaths were attributed to hepatitis in 2015, including 0.9 million deaths owing to hepatitis B. Hepatitis B can be prevented through vaccination. Global coverage of vaccination for that disease among children 1 year of age increased from 29% in 2000 to 80% in 2015. A major risk factor for infectious disease and mortality is the lack of safe water, sanitation, and hygiene service, which disproportionately affect sub-Saharan Africa and Central Southern Asia. That rates owing to the lack of wash service in those regions were 46 and 23 per 100,000 people respectively, compared to 12 per 100,000 people globally in 2012. And now I want to talk about health system and funding. In 2015, total official flows for medical research and basic health from all donor countries and multilateral organizations amount to $9.7 billion, an increase in real terms of 30% since 2010 of the amount. The member countries of the Development Assistance Community of OECD contribute about $4.3 billion. Available data from 2005 to 2015 indicate that over 40% of all countries have less than one physician per 1,000 people, and around half have fewer than 3 nurses of midwife per 1,000 people. Almost all these developed countries have less than one physician and fewer than 3 nurses or midwife per 1,000 people. That's all for my explanation. I hope you all know about that. Thank you.
Okay, thank you for the explanation, Mr. Shahrin, for the progress. And now I will proceed to the Vice President of WHO, which is Mr. Naim. How about your explanation in progress of the health in 2022?
Okay, thank you, Mr. AKASHAH, for the current Vice President of WHO. I will present about the current infectious disease and health system and funding in 2022. For the infectious disease, an estimated 1.5 million new HIV infections and 680,000 deaths from AIDS-related causes occurred in 2020. The incidence of HIV infections globally declined by 39% between 2010 and 2020, far less than the 75 target agreed by the UN General Assembly in 2016. Measures to slow the spread of COVID-19 and the additional strain the new pandemic has placed on health systems have disrupted HIV service. In 2020, an estimated 9.9 million people fell ill with tuberculosis, which is TB worldwide. COVID-19 caused a rise in TB deaths for the first time in a decade, from 1.2 million in 2019 to 1.3 million in 2020, excluding TB deaths in people with HIV. TB incidence is falling at about 2% per year, which is much slower than the 4 until 5% annual decline that was required to achieve the 2020 milestones of the anti-TB strategy. Between 2018 to 2020, TB treatment reached 20 million people, only half of the global target. There was an estimated 241 million malaria cases and 627,000 malaria deaths worldwide in 2020. This represents about 40 million more cases in 2020 compared to 2019 and 69,000 more deaths. About 2/3 of the additional deaths were linked to disruption in the provision of malaria services during the pandemic. Africa was home to 95% of malaria cases and 96% of malaria deaths. Despite significant disruptions to health service caused by COVID-19, the global number of people requiring treatment and care for neglected tropical disease (NTBs) decreased from 2.91 billion to 2020 to 1.73 billion in 2020. Notably, in least developed countries, 48% of the total population required NTDs treatment and care in 2020, down from 79% in 2020. For the health systems and funding, infant immunization coverage dropped to 83% in 2020 from 89% in 2019. The COVID-19 pandemic and associated disruptions have resulted in 22.7 million children missing out on vaccination, 3.7 million more than in 2019 and the highest number since 2005. Moreover, 17.1 million children did not receive vaccines through the routine immunization program, an increase from 13.6 million. Measles is a highly contagious disease, and the current coverage levels of 70% with 2 doses are insufficient to prevent measles outbreaks, illness, disability, and death caused by complications associated with the disease. The human population's vaccine targeting 9 until 14 years old girls to prevent cervical cancer was offered in 111 countries in 2020, but is still yet to reach the poorest countries. Improvement in essential health services as measured by the Universal Health Coverage Service Index increased from a global average of 45 out of 100 in 2000 to 67 in 2019. With the highest score in Europe and North America and the lowest in Sub-Saharan Africa, the pandemic is likely to halt the continuous progress made in service coverage expansion over the past 20 years as health systems face challenges to ensure the continuity of essential health services. Even before the pandemic, the global proportion of the population without pocket health spending exceeding 10% of their household budget was on the rise, exceeding 13%. With the combined health and economic impacts of COVID-19, people are likely to face greater financial constraints to access care, and among those paying out of pocket for health, financial hardship is likely to further worsen, particularly among already disadvantaged populations. Health and care workers remain at the forefront of the COVID-19 pandemic response. In the period between January 2020 and May 2021, the pandemic may have claimed the life of 115,000 health and care workers globally. Data for 2014 until 2020 show that the density of nursing and midwifery personnel in North America remained the highest, over 152 per 10,000 population, close to 4 times the global average of 40 per 10,000, and over 15 times that of Sub-Saharan Africa and 8 times that of Northern Africa and Southern Asia. Despite a steady increase in the density of medical doctors per 10,000 population globally, the disparities between regions remain high, from an estimated 40 medical doctors per 10,000 population in Europe to only 2 in Sub-Saharan Africa. So I think that is enough for me. I give back to the Mr. AKASHAH.
Okay, thank you for the information to the Mr. Naim. Now, we will conclude for the overall in our discussion in this forum. So for the conclusion is, I think for health in SDGs is very important, and overall, all over the world, we as the people should take care of the lifestyle and to maintain our health. So I think now we will close the forum, and for the important, thank you for the Mr. Shahrin and also Mr. Naim for participate in this forum. That's all from us. Thank you.